the low thyroid condition is associated with an unusual facial feature, which is the face gets very puffy. This was described back many years ago as a form, it was given a medical term, which is called myxedema, in which the tissues of the face and the whole body the whole body as well will accumulate fluid and myxomatous gelatinous tissue. It's called myxedema, which is very classical and characteristic for the low thyroid condition. So the face will start looking puffy. There may be hair loss, and it's a very characteristic appearance of the low thyroid patient, the low thyroid condition. So when you go to your doctor and complain of these symptoms, what types of tests will the doctor run to determine if you have a low thyroid condition? Well, they'll do a thyroid panel. Mainstream endocrinologists do the thyroid panel. Most important test on the panel that they rely on very strongly is the TSH test, which stands for thyroid stimulating hormone. What is the thyroid stimulating hormone? This is a little hormone made by a part of the brain called the pituitary gland, which stimulates the thyroid to make more thyroid hormone. So if we have a low thyroid condition, the pituitary gland is like a little thermostat, will sense that and will send out more TSH, thyroid stimulating hormone, and we'll have relatively high TSH levels, which corresponds with the low thyroid condition. The exact reverse is also true. If somebody has a high thyroid condition, they're making too much thyroid hormone. Most typical example is Graves' disease. Then they'll have a low TSH, because the pituitary, the part of the brain, will sense the high thyroid in the bloodstream and will stop making TSH. So the TSH is useful in that regard because it's sort of it's a marker for a high or low thyroid condition. The other testing that the endocrinologist will do is they'll look at levels of thyroid hormone in the blood, free thyroxine levels, which are called free T4 levels, and they also usually test for T3 levels. There are a number of different blood tests for that. When it comes to thyroid lab testing, there's additional testing. For example, if you read some of the commonly used thyroid books, they will talk about reverse T3, they'll talk about thyroid antibodies, things like that. The thyroid antibodies are useful in making a diagnosis of Hashimoto's thyroiditis, in which thyroid antibodies, there are two major ones, the TPO, which is thyroid peroxidase, and the second one is the thyroid globulin antibody. Those are the two antibodies elevated in Hashimoto's thyroiditis, which is one of the more common causes of the low thyroid condition. There are other causes. Let's talk about that for a minute. What are the causes of a low thyroid condition? The thyroid gland, of course, is very sensitive to environmental chemicals, environmental pesticides, environmental toxins like pesticides, things like fluoride, for example, also bromine. There is a thing called polybrominated benzenes, which are the major chemical used in flame retardants. Flame retardants are these chemicals that they put in our furniture and our clothing, mattresses. A lot of states have actually passed laws requiring mattresses to have these flame retardants because in the olden days people used to fall asleep in bed smoking. The cigarette would fall onto the mattress and cause a fire, and the entire buildings would burn down. So many of the states have passed laws requiring flame retardants, and you see those little tags and labels on the mattresses and furniture. So those are polybrominated benzenes. The polybrominated chemicals are highly toxic to the thyroid, as many other chemicals are in our environment. Some of the things in our food are toxic to the thyroid gland. For example, all of the fast food franchises use MSG, monosodium glutamate, and there's MSG in a lot of our foods now. MSG is toxic to the thyroid, and when they feed MSG to animals, little mice in their cages, they find that the thyroid gland is damaged. Excuse me, I'm going to just plug in my power supply. I'm running low. I have a little message that says my battery's low. There we go. Okay. Okay, so environmental chemicals.
Dr. Dash, I think we lost your video.
Autoimmune disease. You know, Hashimoto's. Oh, I'm sorry. What should I do here?
We can hear you, but we can't see you. Can you double check at the top that your camera is turned on?
It says camera turned off.
There we go. We see you.
Well, okay, good. You can see me now?
Yes.
Because it says, okay, there we go. Is it better?
Yes, we're back in business.
Can you see me still?
Yes.
Okay, good. So we're talking about the various causes of, and the autoimmune disease, of course, is one of the big ones, and that's the Hashimoto's thyroiditis. You know, and of course, Graves' disease is another autoimmune disease which causes hyper or high thyroid function. We're going to restrict our discussion to the low thyroid condition, so that's a discussion for another time. We'll talk about Graves' disease another time. The Hashimoto's, of course, is an autoimmune inflammation of the thyroid gland where our own immune system attacks our thyroid gland, and when they actually look at the gland microscopically, there's infiltration with the immune cells, little white cells, lymphocytes, that cause an attack on the thyroid cells. And so the natural history, the natural course of this type of a disease, you may have alternating periods, alternating times for high thyroid function versus alternating with low thyroid function, which can be very confusing to the patient and the doctor because, you know, one week they'll be very hyper, the next week they'll be very tired. It looks almost like a manic depressive type syndrome, and that can be caused by an early stage Hashimoto's disease where you have fluctuating high and low levels of thyroid hormone production. Towards the mid and late stages of Hashimoto's, you have further destruction of the gland and eventual just a steady low thyroid state. Some people with autoimmune thyroid disease do recover, and that's been, you know, described in the medical literature. We have seen that in our patient population. Once the disease has progressed beyond a certain stage, of course, the damage is irreversible. So early stage Hashimoto's, there can be a potential return to normal. What about treatment for various thyroid disorders? In the low thyroid condition, the standard treatment, of course, is thyroid medication. What is thyroid medication? Well, the most commonly used thyroid medication in the United States is a T4 only medication, which means it's thyroxine. T4 means it's a tyrosine with 4 iodines attached. That's also the same name for Synthroid. Synthroid is essentially thyroxine T4 purified. Synthroid is the most commonly used thyroid medication currently in the United States. Another option in terms of medication is a natural thyroid medication, which is also called NDT, or natural desiccated thyroid. The natural desiccated thyroid comes from a pig thyroid gland. It's from a pig. It's called porcine, which means from a little pig. You know, the same little pig we get our ham sandwiches from. They throw away the thyroid glands and don't have much use for them, so they send them to RLC Labs where they turn them into thyroid pills. It's a good thing, too, because the natural thyroid pills from the pig thyroid glands have been around for over 100 years, and they're the best ones. They're the most effective because they have everything that's in the thyroid gland, including T4, which is the thyroxine that's the same thing as Synthroid, and the natural little thyroid pill also contains T3, T1 and T2, and calcitonin, and you know, virtually everything that's in a thyroid gland will be in the natural desiccated thyroid pill. Of course, the most important components are the T3 and T4 and the calcitonin. What is calcitonin? Calcitonin is made by the little parafollicular cells of the thyroid gland, and that's involved in calcium metabolism to keep our bones nice and healthy. That's also included in the natural thyroid pill. Okay. mainstream endocrinologists and primary care doctors will primarily and solely prescribe Synthroid, whereas natural medical doctors, I consider myself included in that group, will prescribe frequently natural thyroid, and the one that I prefer is Nature Thyroid from RLC Labs. Their new formulation is the WP Thyroid, is the purified form of Nature Thyroid, is also very good, and we've started evaluating that. And what I found is what we've done in numerous patients over the years is when patients come to us on Synthroid not feeling well and complaining of low thyroid condition, we convert them to the natural thyroid medication, and in a very high proportion of cases they do feel much better. The very first patient that I converted from Synthroid to Nature Thyroid, natural thyroid, was an 80-year-old lady who had a thyroidectomy when she was in her 20s, so she had been on Synthroid for roughly 50, 60 years, and wasn't feeling 100%. I converted her switched her over to a prescription for natural thyroid pills and started her off on that. She came into the office 2 weeks later, threw up her hands, and said, "Dr. Dash, I feel so much better. Why hasn't anyone ever done this for me before?" And I said, I don't know, Mom." That was my mother. She was my first thyroid patient. And so my mom was the first patient that we switched from Synthroid to natural thyroid, and she had a very dramatic improvement in how she was feeling. And that's been pretty much the same story every time we've switched someone from Synthroid to natural thyroid.
And Dr. Dash, if I may
Yes.
ask, why do you prefer the natural thyroid medication over synthetic? What about the natural makes it a better form of treatment in your professional opinion?
Well, number one, the natural thyroid pill contains all of the ingredients in the thyroid gland, including T3 and calcitonin, and as well as T4, whereas the Synthroid is only the T4, and all of the other important things have been removed to make it as purified T4. Secondly, as I sort of alluded to earlier, when a patient on Synthroid comes into the office and they're not feeling well, they're not doing well on Synthroid, we convert them to the natural. Upon converting them to natural thyroid, they invariably will report that they feel so much better. And so, the years of clinical experience doing that has convinced me as a clinician that the natural thyroid pill is better. Now I have to add that there are many patients who actually do quite well on Synthroid, and I think there are a lot of different factors that can explain why some people don't do well on Synthroid. One of which is the T4. In order for the T4 to be biologically active in the body, it has to be converted to T3, and so there's an enzyme system and a cellular conversion that has to be working. And some people, because the cofactors are missing, this may not work, and they may be poor converters of T4 to T3. In those people, we do see a more robust response to the natural thyroid pill. And there may be other mechanisms at work that we may not know about. This is an area that really doesn't get much research. The study that came out of Walter Reed recently, within the last year, which was published in the Mainstream Endocrinology, and I can send you the link to that. They basically they reported, the endocrinologists at Walter Reed reported that they noticed that occasionally a patient would report to them they feel better on natural thyroid medicine. They feel much better than on the Synthroid. So they actually did a placebo-controlled study comparing Synthroid to Nature Thyroid, and they concluded in their article that more patients feel better on the natural thyroid than on the Synthroid. So we're starting to see articles and studies like that appear in the medical literature, showing that patients just have a more robust response and feel better. with more energy and better relief of low thyroid symptoms on the natural thyroid, which is what we've seen. We've seen clinically over and over again over the years, many years now that we've been treating low thyroid patients. The other question that came up, well, what about comparing Armor to the RLC lab products to the Nature-Throid, comparing Armor to Nature-Throid? And to answer that question, the comment that I can make is when we started our thyroid practice, our medical practice, our clinical outpatient practice many years ago, we had a number of patients taking Armor. They would come to us on Armor, and we would continue that. And then we had a number of patients on RLC Labs Nature-Throid, and we carried both groups of patients equally. And then approximately 3 or 4 years ago, the Armor formulation was changed. I don't remember exactly why. I think Forest Labs bought the company, or they were bought out, or there was some change in ownership of the company, and the formulation was changed. And when we did our repeat labs on our patients on Armor, we found that their thyroid labs went out of whack and looked as if they were taking a placebo, almost like the Armor thyroid pill was not serving as a thyroid medication. And so at that point we decided, well, let's just switch all of these people from Armor to the Nature-Throid, which we did, and they felt much better, and the thyroid labs then came back down to normal, indicating the thyroid pills were working. And after that experience, my advice to people on Armor is, why bother with that? Just switch to Nature-Throid, and it's just one more thing you don't have to worry about. So we don't use Armor. We don't recommend people using it.
And could those negative effects that people were feeling from the Armor be attributed to their ingredients? As you said, they reformulated, and we know that Nature-Throid does not contain dextrose or cornstarch, which many corn-sensitive patients try to avoid. Nature-Throid is also gluten-free and doesn't contain any artificial colors, flavors, and only uses hypoallergenic and active ingredients. Could that have played a role? Well, a lot of our, you brought up gluten, and a lot of our Hashimoto's patients are gluten sensitive, and there's the studies, the published studies show there's an 8 to 15 times increase in gluten sensitivity among Hashimoto's patients. And of course, gluten sensitivity, wheat gluten is very strongly associated with autoimmune disease. Hashimoto's is on that list of one of the autoimmune diseases. And when we test people for gluten sensitivity with the standard testing, we do see many of them test positive. So I think, this is a no-brainer. If you're going to make a thyroid pill, you've got to make it gluten-free for the Hashimoto's patients. So, I think it's sort of shooting yourself in the foot if you manufacture a thyroid pill that contains gluten. It's just going to make people sick. So, I have to be honest with you, I haven't studied the ingredients in the reformulated Armor. Perhaps you know more about that than I do. But, based on our clinical experience and having bad experiences with it, seeing people do poorly on Armor, we just switched. We decided just to avoid that whole issue and just simply use the Nature-Throid, and it it makes things so much easier. It's just another thing I don't have to worry about. The Nature-Throid, I can always rely on that to be a robust, excellent, give an excellent thyroid effect. It's absorbed, it gets into the body, it gives us good thyroid levels, and people do very well on it. They come back and report that, they're feeling better, more energy. They're seeing improvement in the hair and the skin, of course, which is very thyroid dependent, needs a lot of energy. The skin and the hair need energy, which the thyroid gives. So for a long time now, I'm a fan of Nature-Throid from RLC. Of course, there are other companies making thyroid
medications that I'm sure are good. Look, way back we started off with NatureThyroid, and we've been loyal NatureThyroid users since the beginning. It's just a very good product, and we've had very good results with it. And you know, we do have some patients on IRFA, which is the Canadian thyroid pill, and they love IRFA, and they'll order that from Canada. And there are other natural thyroid medications that are available through Europe. They will have their equivalent of the NatureThyroid. I think we covered a few of the items that we wanted to. I think we're pretty much ready for questions.
Absolutely. Before we jump into the questions, I would just like to take this chance to remind everyone to review the disclaimer information that's provided in the about of this Hangout. And a lot of the questions that we did receive were in regards to what is the difference between Armour and NatureThyroid, and Dr. Dash did a fantastic job covering that. So to cover a couple other questions that are commonly asked across the NatureThyroid Facebook page, the WP Thyroid Facebook page, as well as the Thyroid Sexy page run by Gina Lee Nolan, thyroid awareness advocate and former Baywatch star, is what tests do patients need to ask their doctors for? Because oftentimes the TSH test just isn't cutting it for them, or they're being misdiagnosed. So how would you recommend, Dr. Dash, a patient go about taking charge of their health and making sure the proper tests are run so that their potential thyroid issue is not overlooked or misdiagnosed?
Okay, very good question. What testing would I recommend? What I can do is I can go over the routine testing that we do on our lab panel in our office and share that information with our viewers. Our panel includes free thyroid hormone levels, including free T3, free T4. We also have the TSH. We also routinely look at thyroid antibodies on everybody. That's the TPO and thyroid globulin antibodies on everyone. We also look at a few other things that I think are important for the thyroid patient, and that is we look at serum selenium. Selenium is a very important mineral for thyroid function. Protects the thyroid gland from oxidative damage, and is also important as a cofactor for, remember we talked about the conversion of T4 to T3, which is called a deiodinase enzyme. So selenium is a cofactor there as well. So selenium levels have been studied and published in medical literature. This selenium is an important mineral in our diet. We get our selenium from our food, and the amount of selenium in our food depends on where the food is grown. If our plant is grown in a selenium-deficient soil, then we'll have a selenium-deficient diet. And here in Florida, in the southeast U.S., we live in a selenium-deficient soil area. So especially in the southeast U.S., which is selenium-deficient soil, we need to be a little more careful about checking selenium levels on everyone. And if it is low, selenium supplementation is available at the health food store. Selenium tablets, capsules are inexpensive and readily available. There are certain foods that are high in selenium. For example, Brazil nuts are high in selenium. So we do check the serum selenium level on everyone routinely and supplement it when found low. In addition to that, I have to add a very important bit of information. That is, selenium supplementation has been studied and found to be very beneficial for Hashimoto's thyroid patients. Simply by giving the Hashimoto's patients selenium supplementation, the antibody levels will come down. And these studies have been published in mainstream endocrinology literature. So especially beneficial for autoimmune thyroid disease. We also check on a routine panel iodine levels in everyone. There are a number of ways to check iodine. The original method, which was described by Dr. Brownstein in the Iodine Project, is a 24-hour loading test, and that's done by the Fletchus lab, and that's available. The Another test which is commonly done is the spot urinary iodine, and that's the test which is routinely done by the World Health Organization when prior to and after giving iodine supplements to third world country villages. They'll do the spot urinary iodine. So that's a test that is very convenient for our patient group because remember our patient population, they're already at the lab doing blood testing, so it's easy for them just to do a spot urinary sample provided at the Quest lab, and that's the spot urinary iodine, which is a standard test that all of the major labs will do. Those are the major things we look for on our lab panel. We also, also another issue that comes up frequently in our thyroid patients is there may be other hormonal disruptions. Another large area, another important area is the adrenal function. There may be, this thing called adrenal fatigue. And remember, when we give thyroid pills to a patient and they don't do well, they actually feel worse taking the thyroid pill. That's a tip-off and a marker that this patient is suffering from adrenal fatigue. And so we will routinely do a lab test on the panel routinely, which includes the serum cortisol, early morning cortisol, which will give us that information on the lab panel. A low cortisol will be a marker for an adrenal fatigue patient. Of course, there are other important clinical signs on physical examination, such as the unstable pupil and the drop in blood pressure upon standing up. Those are key physical findings of adrenal fatigue. And of course, the patient with adrenal fatigue will have a very profound fatigue unrelieved by sleep. So the clinical history is fairly straightforward in many of these patients. That gives you a little bit of an idea about our lab panel. I hope that answers the question.
Yes. The next one was actually in regards to iodine. I know you just briefly touched on that, but patients just wondering what role exactly does iodine play with the thyroid, and specifically, how does it affect Hashimoto's patients?
Okay, and iodine, of course, is very important for health. And I just want to, before we get into iodine and the thyroid, I just want to mention, so I don't forget, that a big reason why we test everyone for iodine levels and give iodine supplements is because iodine is our major breast cancer preventive. And in our population, we want to do everything we can to reduce and prevent breast cancer. We want to reduce the risk of breast cancer and the incidence of breast cancer even below that of the general population. And iodine supplement, we know that iodine deficiency, which is common in the population, is a risk factor for developing fibrocystic breast disease and breast cancer, and iodine supplementation is preventive of breast cancer. October is Breast Cancer Awareness Month, which is in reality, it's an advertising program for screening mammography, which is what I did for many years. I worked as a diagnostic radiologist, and I did mammography and screening mammography for many years. That's how I made my living on a day-to-day basis. So I'm very grateful to October Breast Cancer Awareness Month for helping me out. But the reality is, mammograms cannot prevent breast cancer. They can detect cancer, but it is not a preventive. The real prevention for breast cancer is iodine supplementation. The iodine supplements are available without a prescription, and they can, for example, you can buy iodine supplements on Amazon, on the internet. It's considered, a supplement. So October Breast Cancer Awareness Month rolls around. They should really, in reality, they should be telling everyone, all women, about iodine supplementation, but they don't. And that's a sad thing, and that should be changed. And hopefully in the future it will be changed. And instead of everyone wearing pink, my idea, which I suggested, everyone should wear purple. Purple for iodine. Purple T-shirts, purple hats, purple sneakers, and all those people walk, with the race walk all the walks with the pink ribbons, and the pink T-shirts, they shall be purple ribbons and purple for iodine. Okay, so what about iodine in the thyroid? Well, the thyroid gland in the neck, its job is to make thyroid hormone, and thyroid hormone is a very simple type of chemical structure. It's essentially an amino acid, which is called tyrosine, which is one of the amino acids, which is a little chemical structure. And attached to the tyrosine are 4 iodine molecules. That's called T4, 4 for 4 iodine molecules. So how does the iodine get in there into the thyroid gland? Well, the thyroid gland has an active transport system called NIS for short, sodium iodide importer. And think of it as a little vacuum cleaner. When the iodine comes by in the bloodstream, the little vacuum cleaner in the thyroid gland sucks it right up into the, it accumulates the iodine in the thyroid gland, which again then is then delivered into the central areas where the thyroid hormone is manufactured in an area that's called colloid, and the iodine is then shuttled into formation on the tyrosine molecule with various little enzyme systems at the microscopic level. And lo and behold, we end up with thyroid hormone, which is then released into the circulation. So that's where iodine comes in the thyroid gland. It's very important in the manufacture and production of thyroid hormone, which each molecule of thyroid hormone contains 4 molecules of iodine. So iodine deficiency, if we have an iodine deficient diet, we live in an iodine deficient area, and there's no iodine in our food, we're going to be iodine deficient. Iodine deficiency, the thyroid gland cannot make thyroid hormone in an iodine deficient person because that's a building block for making thyroid hormone. It's sort of like, well, if we don't have any protein intake, we can't make hair. If we don't have iodine intake, we can't make thyroid hormone. So that's a major cause of hypothyroidism globally, is iodine deficiency. And it's a big problem, especially in pregnant mothers, pregnant women. The developing fetus, the developing baby, needs thyroid hormone in order to develop properly. And if the mother is iodine deficient, then the developing baby will have mental retardation and growth retardation. It's a major global health problem. In 1924, this was such a huge problem in the United States. Iodine deficiency was rampant in the United States. So in 1924, the government decided to give iodine supplements to the entire population. And that's been the case going all the way back to 1924. How did they do that? How did they give iodine supplements to all of us? Well, if you go to the grocery store, go down the aisle where they sell the salt, and you'll see little packages of salt. Like, look at the label on the salt package. It says iodized salt there. And what does that mean? That means iodine has been added to your table salt. So that's the program of giving iodine supplements to the entire population. It's called iodized salt. And that's the major source of iodine for the American population. Some people don't use salt. They don't use iodized salt. And the reason for that is the doctor tells them salt is bad for you. Salt causes high blood pressure. Salt causes this. Salt is an evil thing. Don't use salt on your food. And so these people come into our office, we test them, and they're profoundly low iodine levels in these people, which is, as we know, a health risk for, number 1, breast cancer, and number 2, thyroid problems. We know that iodine deficiency causes thyroid enlargement in the neck. It's called a goiter, as well as other thyroid problems, including thyroid nodules. Multiple nodules are caused by iodine deficiency. Thyroid cancer is caused by iodine deficiency. And, of course, hypothyroidism, low thyroid condition. So iodine deficiency is a huge health problem globally, and that's one of the reasons why we include that on our test panel. We will test everyone routinely for a spot iodine level and to give them iodine supplements. What about iodine for Hashimoto's? That was the next question.
Yes.
Hashimoto's thyroiditis is one of the exceptions where you want to be careful with iodine supplementation early on, because remember, the early stage Hashimoto's patient has fluctuating levels of thyroid function. 1 week they may be high. It's called thyroid toxicosis, where they have all the symptoms of thyroid excess. They may end up in the hospital emergency room with tachycardia, cardiac arrhythmias, because remember, the heart rhythm goes too fast because of the high thyroid level. And then the next week or the next month, they may have a low thyroid condition because the thyroid level has dropped very low. And they may alternate up and down. So the danger of giving iodine to a Hashimoto's patient is that it may aggravate the condition and cause a rapid, increasing inflammation with worsening increased release of thyroid hormone from the gland, and a high thyroid. It's called thyroid storm, a high thyroid condition called thyroid storm. It doesn't happen that often, so it's what we do is we check thyroid. We evaluate the patient with a complete lab panel, and if they have Hashimoto's early stage, we will first give them selenium supplementation. Remember, selenium is the other important mineral, and in my feeling is it should be thought, you should think about iodine and selenium as sort of one idea. Iodine, selenium as sort of little twin brothers that kind of go together, and that's because selenium will protect the thyroid gland from oxidative damage that will happen. Remember, when iodine is incorporated into thyroid hormone, there are these oxidative byproducts called hydrogen peroxide, which are released, which can damage the thyroid gland. And the selenium is there as part of the selenoprotein family to protect from oxidative damage. So what we do is we first give selenium supplementation for a couple of weeks, and then we will start iodine supplementation at relatively low dose of 225 micrograms per day, and then maintain that for a few months. And then over time, if the patient is doing well with antibody levels gradually coming down, then higher levels of iodine supplementation can be used. Some patients have reported on Hashimoto's message boards that they do much better with what we call high-dose iodine supplementation, which is in the 12.5 milligram to 50 milligram range. And there are some doctors who have Hashimoto's iodine protocols, again, in the 12 to 50 milligram range, where they give iodine supplementation to Hashimoto's patients. The effect of iodine can be very beneficial for Hashimoto's patients. Remember that high-dose iodine will actually slow down the thyroid gland and prevent release of thyroid hormone, and it's actually used as a treatment for hyperthyroidism. For example, a patient with Graves' disease, hyperthyroid disease, who goes into the hospital pre-op for thyroidectomy. That's the surgical removal of the thyroid gland as a treatment for Graves' disease. Part of the preoperative preparation is to give them a 50 milligram dose of liquid iodine, which will then suppress and slow down thyroid function enough so that they can do the operation. And that's been around for a long time. It's in the hospital formulary today, and many of the articles on that were written in the 1950s and 60s. You can go back in the medical literature and see that. Any other questions about iodine that I didn't cover?
No, I think you did a fantastic job covering iodine, its role in thyroid function, as well as how it pertains to Hashimoto's patients. So now I would like to take this opportunity to let you...
do we have time for one more comment on the iodine? I just remembered one more thing that our viewers might be interested in. And that is that there was a time a few years back, a year or two ago, when the Fukushima nuclear reactor accident occurred, and the recommendation was to take iodine tablets as protection from the radiation release from the nuclear reactor. And our own government has safety guidelines for nuclear reactor accidents, and our own government recommends that everyone take 50 milligrams of iodine in the area surrounding a nuclear reactor accident to prevent thyroid cancer from the radioactive iodine release from the reactor. So when the Japanese reactor accident happened, there was actually a panic and a rush to purchase iodine tablets, and there was a sudden shortage in the market of iodine tablets because of people rushing to buy them. So I just want to mention that that the 50 milligram iodine tablets have been used and are still recommended for protection from radiation, the radiation release from a nuclear power accident, and it's still part of the government guidelines today. So one of the questions that comes up about iodine as well is iodine supplementation safe? Well, part of the answer is, well, look, we've given iodine supplements to the entire population since 1924, and not only that, but the government recommends a 50 milligram iodine tablet for the entire population around a nuclear power accident. So the other comment that I wanted to make about iodine is we have medications in the pharmacy, in the hospital formulary today that have been around for a long time that contain iodine. For example, there's a medication called SSKI, which stands for supersaturated potassium iodide, which is it's a little bottle with a dropper. It has liquid iodine in it, which you put drops in your water, and that's a treatment for chronic obstructive lung disease. It liquefies the secretions in the chest for people with lung disease, and they're able to breathe better. And that's been available since I was a medical student back in the 70s, for 40, 50 years. And it's still available. You can go to the drugstore, and they carry it in the drugstore today. So that gives people huge amounts of iodine. So the answer is, large doses of iodine in very large amounts have been, people take them all the time and with no adverse effects. So yes, it is very safe.
Okay, well, thank you for adding that.
There are certain...
Oh, go ahead. Sorry to cut you off.
There are certain very rare conditions where iodine can cause adverse effects. One is called the autonomous thyroid nodule. I'm not going to go into that. But for the most part, for the general population, we've all been taking iodine supplements our entire lives, and it's a tremendous health benefit to do that. So that that's the answer to that question.
Very good.
Yes. Did you go right ahead?
Yes. So I think that wraps it up for the questions that we received from this hangout. So right now, I'd like to take the opportunity to allow you, Dr. Dash, to speak a little bit about your practice and the services that you offer there.
Yes, and we have a outpatient clinical office here in South Florida. It's located in Davie, and we see patients with thyroid problems. We use natural thyroid. We also, a big part of our practice is bioidentical hormones for pre- and postmenopausal women. We also do hormone testing and supplementation for men. In men, it's primarily testosterone supplementation. And in addition to that, we look at a very large array of very complex medical problems, including autoimmune disease. We do prescribe a low-dose naltrexone for autoimmune disease, as well as gluten sensitivity, gluten testing. We do extensive food testing. Many of our autoimmune patients will have food sensitivities, and that will show up on the testing panels that we utilize. So we're available. We do have a free newsletter, and I would encourage all of the viewers to take advantage of that. Just go to our website, which is jeffrey-dachmd.com, and click on the little button for the newsletter. You'll be getting the newsletter comes out once a month. We also have 2 books that we've published. The 2 books that I've written and published. The first one which came out in 2008, is Natural Medicine 101. And the second book, which came out in 2011, is Bioidentical Hormones 101. Both books are available on Amazon. And for people who would like to get a preview of the books, you can do that at the website. Each book has a website of the same name, .com, bioidentical hormones 101.com and naturalmedicine101.com. You can go to those websites and read the books. The nice thing about the website version is the references at the end of the chapters are all hyperlinked, so you can click on the hyperlinks and read the original references. If you have any questions about our office and what we do at the office, please give the office a call, and you'll be directed to speak to Dr. Fine. And her job is to answer all of the questions anyone might have about our office practice. Okay?
Well, I would like to, on behalf of RLC Labs, thank you, Dr. Dash, for joining us today for our first hangout in the Hypothyroid Hangout Series, and thank all of our viewers for joining us as well. You can enter to win copies of Dr. Dash's books on the Nature Thyroid and WP Thyroid Facebook pages. That's facebook.com/nature-thyroid and facebook.com/WP Thyroid. Again, please review the disclaimers and note that always discuss specific concerns with your physician. And we will be looking forward to having you on our next hangout. So again, thank you, Dr. Dash, and be sure to like the Nature Thyroid, WP Thyroid, and Dr. Dash's Facebook page. So thank you again,
Dr.
Dr.
Dash.
Dash.
Have a nice evening.
Good night.
Bye-bye.